The skin of our hands is populated by a large number of microorganisms. As we touch objects in our environment, we continuously leave and pick up microorganisms. Hands are therefore the main pathway of germ transmission. For this reason, hand hygiene is the most important measure to avoid the transmission of germs and to prevent infections in healthcare facilities. Touching day-to-day things like other people's hands, lockers, shoes, or coffee cups are typical situations when you get in contact with germs. But when should we perform hand hygiene? Have a look at the following 5 scenes. Like every other person, you have a multitude of different germs on the surface of your skin. Therefore, you are required to clean your hands before having any contact with a patient. This is of the greatest importance because it involves the safety of the patient. This special camera view shows how germs are transmitted by everyday interactions at just the slightest touch. To prevent patients from coming in contact with harmful germs, hand hygiene before patient contact is mandatory. When you perform aseptic tasks, it is of exceptional importance to protect patients against dangerous germs. Hand hygiene is therefore required when germs have easy access to the human body because of broken skin, catheters, open wounds, or immune deficiency. It is essential to clean your hands immediately prior to these duties. Even if you wear gloves, hand hygiene is required before you put on the gloves. You can never be sure that gloves are perfect. Even barely visible lesions can lead to germ transmission. Therefore, clean your hands before performing aseptic tasks, even if you wear gloves. If you come in contact with the patient's body fluids, like here the blood, immediate hand hygiene is vital, and never touch anything with contaminated gloves. After removing gloves, you are also asked to perform hand hygiene again. Ruptures in the material, or the process of taking off the gloves, can create contact between germs and your skin. With immediate hand hygiene after contact with the patient's body fluids, you protect yourself from harmful germs, as well as keep your colleagues and other people safe. After body fluid exposure, hand hygiene is absolutely necessary. After contact with the patient, hand hygiene is also essential. By performing hand hygiene correctly, you avoid the spreading of germs to the healthcare environment and protect your own health. As with the patient himself, germs are hiding in the patient's close environment also. Perform hand hygiene after touching any object or furniture in the patient's immediate surroundings, when cleaning up or leaving the room. Indirect transmission of germs can happen without having direct contact with the patient. And don't take anything from the patient to the nursing room or kitchen. For your own safety, and for the safety of others, hand hygiene after contact with patient surroundings is necessary. Now you know when hand hygiene is necessary, but how is hand antisepsis correctly performed? Apply a handful of alcohol-based hand rub into your cupped hand. Then rub your hands, palm to palm, and cover every part of the hand. Now rub your right palm over the top of your left hand with interlaced fingers, and then vice versa. Next, rub your hands together palm to palm with your fingers interlaced. This helps to clean between your fingers. Now rub the backs of your fingers to your opposing palms with your fingers interlocked. This will clean under your fingernails and nail fold. Rotate your left thumb clasped in your right palm, and then vice versa. Finally, rotate the tips of your fingers in the palm of your opposite hand. Repeat for each hand, and you're finished. Once you are done disinfecting, you must dry your hands. Wait at least 20 to 30 seconds so the alcohol-based hand rub has enough time to be effective. That is important to make sure that all or almost all the germs have been killed. Wash your hands only when they are visibly soiled, otherwise it's better for your hands to perform hand antisepsis. Let's see how hand washing is correctly performed. Wet your hands with water. Apply enough soap to cover all hand surfaces. Then rub your hands palm to palm and cover every part of the hand. Now rub your right palm over the top of your left hand with interlaced fingers, and then vice versa. Next, rub your hands together, palm to palm, with your fingers interlaced. This helps to clean between your fingers. Now, rub the backs of your fingers to your opposing palms with your fingers interlocked. This will clean under your fingernails and nail fold. Rotate your left thumb clasped in your right palm, and then vice versa. Now, rotate the tips of your fingers in the palm of your opposite hand. Repeat for each hand. Finally, rinse your hands with water, and dry them thoroughly with a single-use towel. Use a towel to turn off the faucet. Please take note of the following facts. Before entering the dialysis unit, take off your jewelry. Microorganisms can reproduce very easily in it. Disinfection agents cannot be sufficiently effective here. Keep your fingernails short and do not wear artificial nails or extenders. Take care of your hands by regularly using hand lotion and cream. Healthy skin is better suited to minimize the time that harmful germs can remain on your skin.